Hi, my name is Jonathon M. I am an Army veteran of OIF 5, Iraq. I am also work here at Veterans Village, SSVF, Supportive Services, Veterans and Families. I do intakes in the community. I qualify veterans out in the community wherever they are, whether it's the tent, on the streets, whether they come into the office, and I help qualify them for SROs, single room occupancies. Um, VVSD is a wonderful campus. It provides a lot of different programs. What's really unique to SSVF, though, is that we are a housing first approach, meaning that the veterans always have the choice of where they want to live. They can live East County, South County, North County, depending on their choice of where they want to live. We can work with that. We work with landlords all over the place to get single room occupancies or rooms for rents. The veterans who come to us, some of them have not had any literal homelessness and they've had close to evictions, and we're able to help with that with prevention fundings. But a lot of the veterans that we actually see, probably close to 80% of them are actually literally homeless. And we take veterans from the tent and other communities and we have them come through us. We have a simple process with intakes. We just require a DD 214 or a statement of service, a social security card or a receipt of order, California ID or a state ID that we can give them a voucher for so they can get a free one, and then also, or a passport, and then also any award letter and bank records for the last 90 days. The reason why we require that is because the VA requires that per strict household guidelines. There are income requirements, and the SSVF program here helps out veterans up to the 50% AMI capacity. AMI is annual median income, and so for a family of one, for instance, the income gap is $37,000. So any veteran that makes less than that would qualify for our services, as long as they also have active duty time. So we do take some reservists if they have at least 1 month of active duty time. Active duty time is because, as per the VA standard, they need to be able to qualify for VA healthcare in order to also qualify for SSVF. What's really unique about our program is that we take all levels of veterans in all levels of crisis. Some veterans are newly homeless, some veterans have been chronically homeless, some veterans have different barriers that they have, whether it's alcohol, drug related, whether it's mental health, whether it's physical disabilities, all of these things. And we take these veterans that literally would be just on the street or in the tent, and we give them a second chance to have a home. We provide the security deposit in the first month's rent, and we allow the veteran to choose where they want to live, working with one of our housing specialists and our amazing case managers. And literally, the process is called rapid rehousing. The process isn't as fast as most people would like it. It's faster than the VASH waiting with the VA subsidized housing. It's faster than the Housing Commission. But the process is the process. The process does take time. Most veterans, when they come to us, have multiple issues, whether it's income disparity, whether it's blocks of time in their employment where they just can't maintain employment for longer than a year, constantly moving, whether it's trauma-based things also. And a lot of the time, our case managers are wonderful advocates that they can point them in the right direction to VVSD, to Easter Seals, to these other places that can help these veterans not only get a sense of what they need in order to survive here in San Diego, but also a sense of purpose. When they come here, when they step through our doors, they know that they're being helped. It's a scary process coming in and trusting somebody that you don't know, a team of people that you don't know. But most veterans, once they get their house, once they have hit their 90 days and they have the house and they have the goals and they're making progress, those veterans are extremely grateful. And not all veterans can get to that point, though. Some of them have a lot of barriers, including not being able to maintain a cell phone, not being able to, there's a lot of different barriers, I'll just say. And some of those veterans aren't ready for that housing first yet. And it's up to the case managers when they do come in through, when I do the intake and when the case manager gets them, to realize that this is all about the right touch at the right time. And if that veteran is not in a state that's ready for housing right now, then there are other options. There's main campus VIT SIF program. There's the tent for right now. There's a lot of other places that they can go while they work on mental health, their addictions, whatever it is that's focused on them. If they want to focus on that rather than housing, absolutely, it's always the veteran's choice. They work on what they want to. We do not force anything on any veteran. We don't force a house on them that they don't want. We don't force a product or anything they don't want on them either. It's all tailored to the veteran's choice, tailored to what the veteran wants. The program has a very high success rate. There are some veterans that after a few months no longer need our assistance and they graduate out of the program. There are some veterans that don't even need us for more than just a month. So there are a lot of different variations of veterans that come to us with different needs. Some of the barriers that our veterans also have I wanted to talk about is, besides the employment, besides the mental health, besides the recidivism with drug and alcohol abuse, is really the barriers with the civilian population. A lot of times, I'll give you an example. At the library, most civilians, most people, Americans who are at libraries, when they see a homeless person, when they see them using the computer, they see them reading books, they see them going to the bathroom, they don't see a person. They see someone who is destroying the place. They see someone who is taking away from things. Most people don't realize libraries and a couple other public institutes are the only places some of these people can go to charge their phone, to try to apply for jobs, to apply to get Caltrans work, get food stamps, get all these other things, pay for their child support. When people don't see that, though, they don't see a human being. They don't see a veteran. They see someone who is less than human. And so one of the barriers that I think a lot of homeless veterans, especially homeless veterans, have is that a lot of them aren't looked at like the heroes that they really are. They don't get looked at like somebody who has overcome so many obstacles. They are just seen as somebody that's a plague. And it's one of those things that I really do not like, and I'm trying to change and explain to people that when I refer people to go to the library, homeless veterans, because they have nowhere else to go, I'm doing that because they have nowhere else to go. They need to print out different documents. They need to apply for jobs. They need to be able to apply and do things and maintain their humanity. Because if they don't have that, then what's the point? Another thing I wanted to talk to you about also is that with the Housing First model and the Client Choice model, we do single room occupancies, so single room occupancy of studio apartment, room for rents, those kinds of things. We also help with childcare. So what the veteran is a single parent, they have multiple children. They're not able to work if they can't maintain childcare. Childcare is extremely expensive all over the country, especially in San Diego. And so we provide vouchers and help with after school programs, childcare, those kinds of things. We also help with storage. We help with a moving fee. Once during the program in the 2-year cycle, they are allowed to use a moving service once, whether it's from storage to the new place or whether it's from an old place to the new place. They have those options. They also have a relocation reunification option. If they have family in Salisbury, North Carolina, not a major city, those kinds of things, not Los Angeles, not New York, not Miami, Florida. If they have family somewhere else and they're stuck here in San Diego and they have no options with work, they have a disability, they have a lot of things going on, a lot of barriers to overcome. If they are suffering and they have family somewhere else, we can pay for relocation. We can get them a bus pass, we can get them a train ticket to go to wherever that other family is, to connect with SSVF services nationwide to their city that the family's in. So there is other options like that. So San Diego is not for everyone. San Diego is extremely expensive. We're overburdened with everybody, too many animals, too many people, too many everything. And everybody loves it here. It's a wonderful place to live. And I just want to see everybody being treated fairly. And I think that a lot of the things that people would also see too is people don't see the homeless people, homeless veterans especially, as they see them as victims of their own choices. Now, while that can be true at some points, that's not the entire truth. They're victims also of the trauma they experienced, whether it's in childhood, whether it's in military deployment histories, Vietnam, Iraq, Afghanistan. They have different coping skills, whether it's self-medication with alcohol, drug dependency, and those kinds of things. Some veterans have 30, 40 years of unprocessed trauma, unprocessed rage, unprocessed suicidal and homicidal ideation. And sometimes what they need the most is to have somebody just actually listen, not push something on them, not push treatment, not push getting off the street, but just actually just sitting there and just having a conversation with another human being, because that's what they really are. And they're not a statistic, they're not a number, they're a person. They have a soul, they have a family, they have a past, and they have a future. Most people don't realize that when they see someone like that. They just see dirty, they see unproductive, they see someone that's just a leech, and that's not what they are. That's who they are at that moment. That's not who they're going to be forever. And if we can just see past these people and see past the flaws, past the lack of hygiene, the lack of mental health skills, past all those different things, past the barriers that they have, we need to break down these walls and help our veterans. We need to be able to give them these housing first options. We need to be able to see the potential, like a diamond in the rough, that all these veterans have the capacity to work. All these veterans have the capacity to give back, whether it's to another veteran who's also homeless, whether it's a veteran who's suicidal also. These veterans can and need purpose. And through this Housing First program, through Veterans Village, through this process, veterans claim a sense of identity again. They sense a sense of tribalness, of a group again, whether it was the Air Force, the Marine Corps, the Navy, the Army, Coast Guard. It doesn't matter what branch they were in. When they come here, they have other people there that they can lean on. They have staff, they have other veterans here. They have a community of San Diegans who love veterans, and I want to see every veteran, regardless of their choice or orientation, their color, their hygiene level, their intelligence, their trauma, whether they're undiagnosed or whether they're self-medicating or not. These people all need our help, and they're all worthy and deserving of our help. And we shouldn't push them away and push them to the shadows. We should elevate them and bring them up to ourselves.